how safe are actually any of these injectable products. And the simplest way and easiest way to think about it is how thick the product actually is. The thicker the product, the thicker the gel that you're injecting, generally speaking, the higher the risk of a vascular occlusion. And the thinner the product, the more water-like it is, the less the risk. There's no such thing as zero risk, but if your product is very watery and very thin, the risk is much, 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 much lower than something that is going to be thick. So is there a way that this tragedy could have been prevented? Well, like I said, there's no such thing as zero risk. So good injection technique from an experienced injector can decrease some of that risk. Using thinner products can also decrease some of that risk. Avoiding high-risk areas like the nose, the forehead, the eyes, things like that can decrease some of that risk. If you are going to want to do something in a higher risk area, for instance, around the eye, you can, for instance, choose a thinner sort of a product. The thinner the product, the lower the occlusion risk. The next thing you can do is inject very, very, very slowly. The patient doesn't have a lot of control over that, but you can ask the doctor, talk to them, and make sure that you are reassured that you are talking to a conscientious, careful injector, provider, whatever you want to call them. The next thing you want to do is you want to try to use as little product as possible. The smaller the amount of product, the lower amount of the occlusion risk. Again, talk to your injector provider. And another thing that you can talk to your provider about is their injection technique. Using, for instance, cannulas over a needle has also been shown to be lower risk. So while there's no such thing as zero risk, even with perfect technique, things can go wrong. You can take multiple steps to push that risk as low as possible. If you ever find yourself in a similar situation, here are some of the factors to consider. If everything has gone perfectly, the provider, perfect technique, good documentation, consented you well, litigation may not amount to much. You don't generally win litigation because of bad luck. But if you can identify certain areas where the doctor was not conscientious, they were being quite reckless, there is a higher chance that you will be compensated as part of litigation. The next thing you want to consider, of course, is the person you're going to actually a licensed provider? Right? So if you have like a nurse injecting or you have a doctor injecting, they probably have malpractice insurance. And it is more likely that in case things did not go as planned and there were mistakes made, the malpractice would kick in and you would be compensated. However, if you're going to unlicensed providers to get your injectables, they're probably not insured because the insurance companies are not going to insure unlicensed providers. So whether or not you get compensated, completely up in the air, I would say probably not. The most that you could hope for is you file a criminal complaint for practicing medicine without a license, and some justice will be served if they go to jail, but you may not be financially compensated in that situation.